on behalf of Dean Sue Curry, who unfortunately has to be out of town at a meeting of the Preventive Services Task Force, or actually a congressional hearing. She's the vice chair. There's a congressional hearing on the Preventive Services Task Force in D.C. today, and consequently, she was summoned to Washington, D.C. I think some of you have been in positions like that and can appreciate why she had to go. But I know she would, and Dr. Uden-Holman earlier indicated this as well, she'd much rather be here with you than wrangling in Washington, D.C. at this point. So on behalf of Dean Curry and the College of Public Health, it's my pleasure to welcome you to this year's, the 17th annual Iowa Public Health Practice Colloquium, as well as a program that is very near and dear to Dean Curry's heart, the Public Health Heroes Award. So we have a wonderful program for you today, and Dean Uden-Holman will elaborate on that in a few minutes, but first we want to bring recognition to this year's Public Health Heroes Award, the 2016 Public Health Heroes Award. As Dean Curry and others have often observed, public health, when it accomplishes its mission, its work often goes unrecognized. How do you demonstrate the benefit of something that didn't happen? Preventing a disease or preventing an injury are the kind of things that as public health practitioners we dedicate our careers to. But it's hard to show the statistics that somebody didn't get sick or somebody didn't get injured. And yet that's what the field of public health endeavors to do. And I think just intuitively we understand the benefit to the quality of life if you don't get sick, if you don't get injured. And so consequently, the importance of public health working, even though it's invisible, is a critical aspect of what we try to do as a profession. That was the reason that Dean Curry, one day in a staff meeting, said, you know, we ought to identify some of the people who don't get recognized for doing this unrecognizable work. And that's kind of how the Public Health Hero Program was established. So each year, the college recognizes, and led by Dean Curry, the college recognizes individuals who have worked to promote a healthier state through wellness and disease prevention initiatives and demonstrating the values of the College of Public Health, including community engagement, integrity, continuing learning, quality, responsibility, and social justice, the values that this college has adopted. And this year, it is our pleasure to recognize 4 of these heroes. First, somebody that I've known for goodness sakes, 25 years or more, and I remember sitting in the entryway to Drake University probably 20 years ago talking about careers and where we go next, because both of us were kind of at a fork, not a knife, a fork in our careers. Mary Hansen has been a health leader in Iowa since receiving her nursing degree in 1970. As director of the Iowa Department of Public Health from 2003-2007, she was instrumental in beginning the Modernization Public Health in Iowa initiative, which aims to advance the quality and performance of public health in Iowa. This actually predated some of the work now that we're seeing at the national level with the Public Health Accreditations Board. And so this national movement that we're seeing now was actually presaged by some of the work that Mary did here in Iowa. And it was leadership such as that that led her to become the president of the Association of State and Territorial Health Officers back in 2006. Does it seem like 10 years ago, Mary? Oh, okay. From 2007 to 2014, she was on the faculty at Des Moines University and directed the Master of Public Health program. She's on the State Health Department's Public Health Advisory Council, co-chairs the Des Moines Age-Friendly City Health Committee. She's the former chair of the Healthy and Well Kids in Iowa, the Hawkeye Board. which oversees the Iowa State Child Health Insurance Program. She also served on an Institute of Medicine committee that prepared reports on population health funding, policy, and data. She's currently the president of Hanson Health Consultation. Please join me in congratulating and welcoming Mary up here for a few remarks. Dr. Mary Hanson.
Wanted to clarify that I was about, I think, what, 20, very early when we started meeting, Chris, if I remember correctly? Milk and cookies it was, and we won't talk about that later as the police came. However, one of the things that I do want to say is that I want to thank the University of Iowa. This is very important and not done nearly enough for public health professionals. I also want to thank the person that nominated me, and I would like him to stand up, please. Dr. Ron Eckhoff, where is he? Okay. Could we please give a round of applause? He has been a true hero for a number of years in public health. What he has done is, we don't have enough time to talk about. They only gave me, what, 3 minutes is all I have? Those of you who know and heard me speak before, that's going to be hard to cut down. Also, what I want to talk about is a little bit about public health. As Chris said, when we do well, we are invisible. And there's something wrong with that. You know, too many times we say, oh, but that's okay because we're just doing the good work. That's not okay. We are critical to the future of this country, this state, and the families that we serve. And so, again, to bring a spotlight to those of us who do this, I am very, very grateful and very honored. But finally, many people say, and will tell you, that this award, the positions that I've had, I was the face of the organizations. However, the work that got done was done by the people in the trenches. So there's about 500 people that I've worked with who also deserve this award. So would the university have the budget to be able to get enough for those? All right then. Anyhow, for all of you who are here, I do want to, oops, is my picture here? No. I do want to thank all of you. Many faces I've seen here. It's just been a true joy to be able to work in public health and the good work that we do. Thank you again so much. Ready to take it now? Thank you so much. We're so appreciative.
Thank you, Mary. This is really fun for me because it's like all four of these individuals are people that I have the greatest respect for. Like Mary, her contributions to public health, Bonnie Rubin began her public health career in 2002 as Iowa's first CDC Laboratory Response Network Emergency Preparedness and Terrorism Response Coordinator for an organization I have some association with, the State Hygienic Laboratory. Bonnie continues to work to ensure collaborative efforts of clinical laboratories, public and state public health departments, emergency responders, law enforcement, and other agencies to prepare for unexpected natural and man-made emergencies. Prior to her retirement just this last July, Bonnie served as the Senior Associate Director at the State Hygienic Laboratory, where it was my pleasure to have her implementing new processes and systems to ensure that the state's public health laboratory remains current, both in technology and capability to meet the needs, the emerging needs of diseases and other contributors to the quality of life in the state. But she's not just involved on the laboratory side. She's a past president of the Iowa Public Health Association, currently is entering her second term on the Johnson County Board of Health. She's a site visitor for the Public Health Accreditation Board that I referred to earlier, helping public health departments across the nation achieve Mary's vision of a modernized public health system. She's also on the CDC Clinical Laboratory Improvement Advisory Council, council, and during these times of health systems change, the work of that agency will be terribly important. So please join me in welcoming Bonnie Rubin to the podium.
Well, those of you who know me, this is one of the very rare times I have actually prepared some remarks, because this award does mean a whole lot to me. It really has touched me, and I wanted to express my gratitude in an adequate way. First, I want to thank the Iowa Public Health Association Board for nominating me, and to also thank the College of Public Health for selecting me to be part of this very, I feel, notable group for this honor. The members of the Iowa Public Health Board did do a very good job of not telling me about the nomination. And then when I got the email that said, "Congratulations, you have won an award," I almost put it to spam. And then I thought maybe I should look at this, since it came through the University of Iowa email, and it was signed by Dean Curry. So I did take the time to read it, and I'm very glad I did. Throughout my career, as you have heard, in laboratory science, I've always told my colleagues and my staff that the beginnings of new ideas and the beginnings of everything is always the right time, right place, right people. If it weren't for 9/11, I may not have moved back to Iowa from Boston. If not for the anthrax letters, there would not have been the funding to support a brand new position at the State Hygienic Laboratory that Chris said got to be the first. My first title was called Bioterrorism Coordinator. We thought perhaps that wasn't quite describing what I should be doing, so we changed it. But that position gave me the opportunity to work with a really diverse group of people in public health and emergency response. That led to a statewide protocol for emergency response and chemical and biological terrorism response that is still in place today and was used as a national model throughout the nation. I've been very fortunate to have two bosses at the State Hygienic Laboratory, Dr. Mary Gilchrist, who was part of my hiring, and then Chris Atchison. They were both very encouraging to me to be active in various public health initiatives at the federal, the national, the state, the regional, the local levels. I would never have had these opportunities to impact laboratory science, public and environmental health policies and initiatives unless I had been working at State Hygienic Laboratory. I've also been very fortunate, excuse me, and he doesn't know I'm going to say this, but for a very supportive spouse, Charlie Williams, who agreed to be a stay-at-home dad when I took my job out at Boston. Then when we moved back here, agreed again to be a stay-at-home dad. That gave me the opportunity to go throughout the nation and the state to get the job done in public health that I wanted to accomplish. As everyone will probably has and will do, I also want to acknowledge and give tribute to the many colleagues I've worked with who have helped my career be the success it's been. As a public health professional and a member of the Johnson County Board of Health, I want to today especially recognize Doug Beardsley for all that he has done and his support of my efforts in public health. I ask you to join me at some point in your life to pray for his complete recovery from his recent illness. He was released from the intensive care at UIHC. He's now at rehabilitation at St. Luke's in Cedar Rapids. He continues to recover, and it looks pretty good, but please think of him during this recovery. Although I'm officially retired from University of Iowa after 38 years of service, again, just like Mary, I started in my teens, I plan to continue to be active in public health, as Chris has pointed out, doing things in laboratory medicine and in public health at the national, the federal, and the state and local levels. As you've heard, I'm not done yet. So I would like to close with some quotes that I have lived by throughout my professional life, which has led me to this honor today. Although this quote is attributed to C.S. Lewis, the first time I heard it was from Kelly Hayworth, who is the current city manager at Coralville. He said, "Integrity is doing the right thing when no one is watching." To keep my outlook on life and myself in perspective, I have always had Oscar Wilde's quote in my toolbox, which is, "Life is too important to take seriously." For you students going into your professional lives, always remember that. And finally, having grown up in Springfield, Illinois, I'm a little bit of a Lincoln file, and I leave you with his words. "In the end, it's not the years in your life that count. It's the life in your years." Again, thank you.
There's stuff, too.
There's stuff.
Next, someone who has been described today as tenacious, and I refer to Dr. Bob Russell. Dr. Russell, whom I've had the greatest of respect and admiration for more than 10 years, has been a state and national leader in expanding access to oral health services. Since becoming Public Health Dental Director for Iowa in 2005, he has spearheaded the development and implementation of the iSmiles program, which improves access to preventive dental health services for children receiving Medicaid. He also leads the iSmiles Silver program. I don't know what the silver refers to. An innovative pilot project to provide dental care for older Iowans in nursing homes or confined in their own homes. Dr. Russell has been an advocate for supporting fluoridation of public water supplies. He has served on the board as a board member for the Delta Dental of Iowa Foundation since its inception in 2008. He is one of the best transplant from the University of Michigan that we could possibly have, Dr. Robert Russell.
I am both humbled and honored to be here today and to thank you who have recognized some of the small things we do to try to make life better for all Iowans. I want to recognize first Dr. Mary Hansen. She's the one who brought me to the state of Iowa with her magic wand. And there's a story behind that. But when I saw that wand, I knew I was stuck. So I definitely wanted to be a part of this team. It has been wonderful because she set the vision and just said, go, get it done. And that's what I did. But I also want to honor today my current director, Dr. Claybaugh, Gerd, who continues a wonderful vision for our department, who has turned a group of what we call misfits into a marching unit and with a goal and a direction that we now feel like we can achieve. And a vision that I feel very comfortable with, and it's great to work with such a visionary. But I also want to thank Dr. Kathy Weeno, one of my best friends and a colleague of mine who started off together in state dental programs, went on to the CDC, but continued to give me wisdom and guidance in the things that I like to do and try to make the vision possible. I'm guided by a very simple thing, and this is my little mantra. It's not the destination, it's the journey. And it's been that journey that has kept me vital and energized to do the things that I see done. It's Iowa that makes it possible. I can tell you surely, I've gone to many states, I have looked at many programs, and there's nothing like what we have in this state. You do not realize how much of a jewel you really are. And every time I see the sign, I see the fields of opportunity. When I first came to the state, I knew there was something different here. You know, I'm a Michigander, you know, Michigan's good, but I really, it's good, but it's not a place I miss. I am truly now a Hawkeye, and so I was very delighted that our team took out Michigan, and believe me, and I say that but I say that also in great levity because I'm so delighted to be a part of the winning state. And we are winners. We are truly winners. And I do want to lastly say, I want to thank my wonderful staff. I've had the pleasure of working with one of the best oral health teams you could ever have. You know what's good? In my team, I don't have to manage. All I have to do is give them a vision. And as long as I encourage that flame, they go out and do. And so when you talk about iSmile Silver or school screening or sealant programs, which now all 99 counties are covered, and I'm proud to say, which is not done anywhere else. The reality is because I have a team that just gets out there and gets it done. And that's what it really is about. It's about a team. And so I really want to thank them today. Even though they're not here, they're busily working their jobs. But the reality is, wherever I go, they're with me. And I feel the same for each and every one of you. So thank you so much, and keep up the good work. And always, the vision is what we want to get done. Thank you.
One of the elements of public health that this program, this effort represents is that it's not just people within the direct practice of public health organizations that represents public health achievement. Public health, in fact, represents many disciplines coming together to achieve better health outcomes, and that includes the legal profession. And that's why it's our pleasure today to recognize the work of Kevin Tekow. Kevin has had a distinguished career as lawyer and leader at both the federal and state levels. As commissioner of the Iowa Department of Public Safety, he spearheaded efforts to improve Iowa's graduated driver's license program, promote increased seatbelt use, lower traffic fatalities, and increase training for firefighters. In his current role as the U.S. Attorney for the Northern District of Iowa, Attorney Kevin Tekow launched statewide and community efforts to reduce the burden of opioid addiction and overdose, in addition to working to increase the number of safe receptacles for opioid prescription medication in pharmacies and police departments. He collaborated with partners in healthcare, public health, law enforcement, business, and the faith community to convene Iowa's first statewide opioid heroin summit in November 2015. He's continued to hold meetings throughout Iowa to engage stakeholders in this emerging issue and other social problems. A tremendous leader, not just in law, but in public health as well, Kevin Tekow.
Chris, thanks for those kind words. It's an honor to be recognized by my friends and colleagues in public health. The thing that brought me here, first I want to mention I'm a double Hawkeye, graduating from the College of Business, and then when the law school was here on the same spot. So I was telling the group before, I have a geographic connection to public health, even though it was a few years ago. But John Lundell and his colleagues at the Injury Prevention Center, first got to know them when I was honored to be the Commissioner of Public Safety, and we started working together. And they explained to me and taught me the benefit of having evidence-based solutions to problems that were mentioned, seatbelt, teen driving, and others. And that really reinforced to me, and it's become my mantra, is that we work best when we work together, federal, state, and local, and we work even better when we work with communities, whether it's faith group or not-for-profits or other everyday citizens. And so that's been my intent when I've been given the opportunity, is to direct initiatives that really build on evidence-based solutions, and so often that comes from the academics and practitioners of public health that solve some of our biggest problems. Because there's no more important mission for government than to prevent injury and disease and trying to keep people safe. And so it's those evidence-based solutions that really allow us to do that. And so during my time at the U.S. Attorney, when we became aware of the opioid heroin issue epidemic, if you will, that spread across the country and is starting to impact us here, I turned again to my friends at the Injury Prevention Center, which led to the symposium here, which has led to a number of conversations that have put us in a better position to tackle that problem across all disciplines. And so Bob mentioned teams, and that's what it's all about, working together. And that reminds me of my favorite sports story, is the night that Michael Jordan scored 70 points, and Stacey King, his teammate, at a press conference afterwards, who scored 1 point that night, said he would always remember the night that him and NJ combined to score 71 points. And so you never know what your role is going to be, what part you're going to play, but we all have an important role to play as a team to solve these problems. So it's a great honor to be recognized by my friends in the public health, and I'll continue to do that when I have the opportunity. So thank you very much. Thank you.
Well, that's this year's recipients. Please, let's give them one more hand if we can. And thank you all for joining us and recognizing these people who continue to do great work for public health. And now, on to the symposium.